Symptoms caused by viral sexually transmitted diseases can be treated, but they cannot be cured. So it's always important to take precautions and not pass these to others. Genital herpes is caused by the herpes simplex viruses. There's herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 is more common above the waist, such as cold sores, whereas herpes simplex virus 2 is more common below the waist. Herpes simplex virus 1 and herpes simplex virus 2 can pass to above or below the waist between these two viruses. Both enter the body at mucous membrane or breaks in the skin integrity. The fluid in the blisters contain millions of viruses. The initial symptoms include fever, aching muscles, and swollen glands in the groin. The initial symptoms may last between 2 to 20 days, typically averaging around 6 days after the initial contact. Blisters appear, may ulcerate, leaving sores, and of course most contagious at this time because these blisters contain millions of viruses. Blisters typically last approximately 2 days before they ulcerate, and this is also the greatest period of increased risk because of acquiring, may even acquire HIV if exposed at this time. Virus retreats to the ganglia near the spinal cord and can be reactivated during times of stress. Symptoms may not be present or be so mild they go unnoticed. Most cases of genital herpes are transmitted by partners who have never had symptoms or whose symptoms were atypical or gone undiagnosed. Herpes infection can sometimes spread to a growing fetus and cause a miscarriage or even stillbirth. Most women who have herpes have successful pregnancies and normal deliveries. Can be transmitted to the fetus during delivery, especially if this is a time frame when sores are present. So delivery by cesarean section avoids exposure of the baby to the virus. Diagnosis for genital herpes is examination of sores in which fluid is tested from the sores for the presence of the virus, or to identify the DNA of the virus from a swab of the infected area. May even look for blood tests that the individual's body has begun to manufacture against the virus. The blood test may not be useful during the initial attack, as it takes several months for these possible antibodies to appear. Treatment includes antiviral drugs. Since herpes is a virus, it would entail antiviral drugs, which will aid to ease the symptoms, reduce the frequency of reoccurrence, and different strains are becoming more resistant to these antiviral drugs. Genital warts are caused by several different human papillomaviruses. It is the most common viral sexually transmitted disease in the United States. The body's defense mechanisms usually eliminate the human papillomavirus without the virus causing serious health problems. However, certain strains of the human papillomavirus can persist for long periods and can lead to cervical, penile, or even anal cancer. 50% of all sexually active people will acquire an infection, estimates are of the human papillomavirus at some point in their life. And of course most are not even aware because they lack symptoms. Estimates are that one-third of the penile cancers in the United States are believed to be due to the human papillomavirus, and 90% of all women with cervical cancer have also tested positive for isolation of the human papillomavirus as well. And pap smears, though, regularly check for the presence of human papillomavirus. Diagnosis includes appearance of genital warts in women, also by the appearance of the precancerous cells in yearly exam or in the pap smear. Treatments are intended to kill the cells containing the virus, may include freezing, burning, laser surgery, and or chemical treatment. These may serve to destroy the visible warts, but human papillomavirus may remain in nearby normal-looking tissue and cause new warts to form weeks or months later. There's the new vaccine, the Gossett, for females. It's effective against 4 types of human papillomaviruses. This includes 2 strains responsible for most cases of cervical cancer. Recommended for vaccination before sexual activity at the ages 10 to 12, and currently there is no equivalent vaccination for men. AIDS, or acquired immune deficiency syndrome, talks about acquired. It's not inherited like many other immune deficiencies. Syndrome is the term given to a set of symptoms caused by the human immunodeficiency virus, HIV. The primary targets of HIV are the helper T cells, which serve as the main switch of the immune system. Infection and eventual death of helper T cells cripple the immune system. This leads to that individual being susceptible to opportunistic infections occur, eventually leading to death. HIV is a global pandemic. At the end of 2009, it's estimated approximately 31 to 35 million people were living with an HIV infection. Africa is currently the hardest hit area by HIV, and it's estimated that 2/3 of the people currently living with HIV are in sub-Saharan Africa. 30 million people, estimates are, have died worldwide as a result of HIV. Structure of HIV, it's known as a retrovirus. Its genetic material is RNA. HIV utilizes an enzyme known as reverse transcriptase, which is going to convert its RNA into the individual's or the host DNA. HIV also has several virus-specific enzymes. It's got a protein coat that surrounds its RNA and its enzymes. The envelope surrounds the protein coat and consists of protein units embedded in its lipid membrane, and the lipid membrane is just a piece of plasma membrane it received from a previous host cell. This image of the HIV shows the HIV's genetic information is RNA, so it's single-stranded. Shows the enzyme reverse transcriptase in the center. This is the enzyme that is going to allow the HIV's RNA to be rewritten into the host or the individual's DNA. The protein spikes, HIV's protein spikes that's embedded into the envelope, the tips are going to fit into the receptor cells on the host cell, allowing HIV to enter the cell, primarily the helper T cell, the main switch to the immune system. And the envelope comes from the cell membrane of a previous cell host. The life cycle of HIV is that it binds to an uninfected host cell. That protein spike of the HIV is going to fit into the CD4 receptor on the host cell, and the helper T cells are the predominant cell type with these CD4 receptors, and therefore the helper T cells are the targets of HIV. Once they bind, the contents of HIV enter the host cell. Inside the host cell, the enzyme reverse transcriptase rewrites the single-stranded HIV's RNA into a double-stranded DNA. The newly formed viral DNA is spliced into the host DNA. Each time the host cell reproduces, it's the viral DNA copied along with the host DNA. Thus, eventually, the cell becomes a factory for the HIV virus. The viral components will bud off from the host cell and self-assemble into new viruses. After the HIV has been incorporated into the host DNA, the host cell treats the HIV genome or genetic information as its own. And so this shows the steps. HIV attaches to the CD4 receptor on the cell membrane of the host cell, and this would be primarily the helper T cell. HIV will fuse with the cell membrane and release its contents into the host cell, into the individual cell. The HIV's protein coat is going to break down, and HIV's RNA and reverse transcriptase, its enzyme, are released within the cell cytoplasm. Reverse transcriptase is going to rewrite HIV's single-stranded RNA as HIV's double-stranded DNA. In step 5, the DNA from HIV is going to enter the host cell nucleus and it's going to be inserted to the DNA of the individual's, the host cell chromosome. Many copies in step 6 of the single-stranded HIV RNA are then made. They're going to direct the synthesis needed for the HIV's proteins. Step 7, HIV is going to leave the cell. The HIV RNA and proteins are going to gather at the cell membrane and leave the host cell as an immature virus. HIV RNA and proteins are reassembled and form a mature virus. The HIV genes can reside in a helper T cell chromosome for years until the cell is activated to respond to some foreign antigen. At this point, the virus begins making copies of itself instead of allowing the helper T cell to fight the invader of infection. Some of the HIV RNA becomes genetic material for new viruses, and some is used to produce virus-specific proteins. New viruses move into the bloodstream and can infect new host cells. Transmission of HIV is found in many bodily fluids such as tears, saliva, urine, cerebral spinal fluid, amniotic fluid, semen, vaginal secretions, breast milk. And HIV cannot be transmitted through casual contact. HIV transmission major modes include unprotected sexual activity, intravenous drug use, becoming in contact with infected blood from an infected mother to her offspring, across the placenta during delivery, or also in breast milk. Tattoos, piercings are also classified with needle uses under like the drug use. An HIV-infected mother not treated has about a 25% chance of spreading to the newborn, and also not breastfeeding. If the mother is receiving treatment with antiretroviral drugs while pregnant, there's less than a 2% chance of transmission to the newborn. Stages of HIV infection is initial infection, asymptomatic infection stage, initial disease symptoms, early immune failure, and then finally AIDS. HIV infection is typically monitored by the decline in helper T cell and increase in viral load detected in the blood. And so this just shows the year since infection, and you see the CD4 T lymphocytes. These are the helper T cells. So at the initial infection, there's high range of CD4s to fight off, still in the asymptomatic stages. Initial disease, you can see the waning of these CD4 T lymphocytes, or these helper T cells that begin to wane. And so as you progress through the different stages, it's the HIV, the individual's immune system, helper T cell resources are not there to fight off the infection. The initial infection is the virus replicates and the levels of HIV rises. The body's immune system is going to produce antibodies, begin producing antibodies against the virus. And so HIV tests look for antibodies to HIV in the blood, and if the antibodies are found, the person is described as being HIV positive. Typically at this stage there's no symptoms or very mild symptoms. The initial infection stage is a dangerous stage because many people are unaware that they're infected and are particularly contagious at this point. The antibodies may be detected within 8 weeks. However, in some cases may not be detected for months or even years. Mild symptoms such as enlarged lymph nodes, fatigue or fever may be detected during the initial infection stage. The asymptomatic stage is just that the immune system mounts a strong defense and the infection is controlled, but it's not conquered. The virus is in the lymph nodes and still infecting millions of cells. The initial disease symptoms talks about wasting syndrome. This is used to describe unexplained weight loss. Approximately 10% also have diarrhea. Swelling of the lymph nodes, such as in the neck, the armpit, and the groin. And during the initial disease symptoms, also can experience neurological symptoms, including weakness, dementia, and paralysis. And still steadily, the rate of helper T cell production is going to continue to decrease. Early immune failure is that as these T helper cells continue to decline, the body becomes increasingly vulnerable to infections such as thrush and shingles. Thrush is just a fungal infection in the mouth. Shingles is a painful rash caused by the same virus that causes chickenpox. Finally, a diagnosis of AIDS is made when an HIV-positive person develops one or more of the following conditions. Helper T cell count below 200 millimeter cube of blood. 1 of 26 opportunistic infections such as Kaposi's sarcoma, which is a cancer of the connective tissue that primarily affects the skin. Loss of more than 10% of body weight, or dementia. Treatments include can be used to prevent these opportunistic infections and improve the quality of life and lengthen the life of AIDS patients. They help also to slow the rate at which HIV can make copies of itself. And there's several classes of antiviral drugs which each blocks a particular step in HIV's replication. There's protease inhibitors that slow the assembly of new viruses. There's inhibitors for the enzyme reverse transcriptase, which slow the entry into new host cells. However, HIV, as of today, can never be successfully eliminated from the body. New approaches to combating HIV are antiviral drugs that prevent HIV from entry into a cell. They've looked at efforts to develop a vaccine, but the characteristics of HIV make this very challenging because it has a very high mutation rate. There's two types of HIV, HIV-1 and HIV-2, and within those there's many different strains. So antibodies cannot attack the virus also when it's hidden inside the cell, because recall, HIV gets inside our cell and takes over the cellular machinery. So determining how to produce a treatment that can get inside the cell and just attack the HIV without the integrity of the individual cell is